Our resource share for this meeting is with the Community Response Network. I met Terry Becker Fritz from this agency back in 2018. Yeah, when I started this position, and we talked on the phone a few times, and then Virginia Beach happened in 2019. So I'm finally able to share this resource. I know that some of you, I think in Region 10 and the Virginia Beach area, probably have some familiarity with this group. Um, so with that, Sarah, thank you for being here with us today, and I will turn it over to you.
All right. Am I unmuted? You can hear me? Okay, thank you. I will share. I did make a short presentation just so you can look at something besides me here. So hopefully you all can see that. And I'm here to talk about the Virginia Community Response Network, or the VCRN. I am a board member and the vice chair of the VCRN. And our hope for today is to tell you a little bit about who we are, what we do, and a little bit about what we've already done, and so that we can hopefully have some partnerships with you all going forward. So how the VCRN got our start. Actually the VCRN, the idea for the VCRN, it was initially back in 2015. With Terry Becker Fritz and Chris Santamaria in Charlottesville, saying we really need a trauma recovery network in the state of Virginia. And trauma recovery networks were originally affiliated with HAP. And I don't know if you're familiar with HAP, that's the Humanitarian Assistance Programs. And they do a lot of training of clinicians to use EMDR protocols or trauma response. And so in 2017, the Central Virginia Trauma Recovery Network was established, and we did that work as a TRN for a couple years before realizing we wanted to work outside of the parameters of a HAP TRN. Specifically, we wanted to be able to respond to communities when there had been a disaster, bring our volunteer clinicians, not just focus on training. We wanted to train those clinicians, but we also wanted to be able to come and do the work. And we wanted to be able to fundraise to support that work. And we weren't able to do fundraising for our TRN. That would just be fundraising for the HAP. So in May of 2019, we separated from HAP as a TRN and rebranded ourselves as we are today as the Virginia Community Response Network. We are now a charitable organization. So let me tell you a little bit about what we do. We are an organization made up of licensed therapists in the state of Virginia who are trained in EMDR. That is the modality of therapy services that these clinicians provide in their practice. And we use specialized protocols in our treatment in response to traumatic events that are early intervention, that use EMDR techniques. Our belief is that early intervention significantly reduces the distress after traumatic events. And so we really want to be able to move quickly to respond to the therapeutic needs in the communities in Virginia. And we also really believe that these early interventions that are based in EMDR techniques are very effective. And we have research that shows that, and we gather our own data that is showing these are really effective at bringing down the distress after a traumatic event. Currently, we have 46 to 50, I think, licensed clinicians who are on our team. We do an annual training every year so that everyone is trained in our protocols, specifically those early intervention protocols. And we have folks who are all throughout the state of Virginia. We have a board of directors. As I said, I'm on the board that guides the leadership, and we are funded through fundraising that we do annually. We typically bring a very well-known speaker or trainer on EMDR and open that up to all EMDR clinicians. So it doesn't have to be our volunteers, doesn't even have to be folks in Virginia. We open up that and and that is how we fund our services. And that way, we're able to, for example, if we send volunteers to deploy to a locality to offer on the ground services, we want to make sure that we have all the materials that we need, hotels, food, everything that our volunteers would need, so that they're not using money out of their own pocket. They're using their time as their resource. So let me tell you a little bit about why the VCRN would be requested, our services would be requested, or why we would deploy. I'm sure that you all know this, but we share this information with our community to help them understand after a disaster. A lot of times, survivors of that disaster or their loved ones or the first responders who attend to that disaster may experience a lot of signs of distress. A lot of time those things are emotional, mental, or somatic. And those that impact, if not addressed, can really go on to manifest as long-term traumatic distress. And so we really believe early intervention is key. And when I say early intervention, I'm really speaking of within 3 months of the event. We want to, obviously the sooner the better, but we're talking about getting in within the first 3 months to treat these signs of distress, to reduce those. So we would accept referrals for a huge variety of events that could happen that we could classify as a disaster. Of course, we have natural disasters, mass shootings, workplace tragedies, or other events that in the community that is a tragedy that impacts a larger amount of individuals. So, for example, if there's a very traumatic death where there are a lot of witnesses, a lot of people are impacted by that. And we receive our referrals. Really, we will accept a referral from anyone who is aware of a disaster that has impacted a community, and the community saying, yes, we want some support here. We don't just show up after a disaster. We receive an invitation before we would show up. So we're open to any organizations or professionals or just community members. Sometimes that could be like local therapists who are aware they're getting lots of requests for services and realize that the capacity is just overwhelmed. So when we get a request, we're going to ask ourselves a bunch of questions like, how many people were impacted? What are the resources already in the community? Is this beyond the local community's ability to respond? So, for example, if there is a school system that has one school counselor and they're getting lots and lots of calls because something impacted a bunch of children, we would respond to that because that exceeds their capacity to respond. We are also thinking, what was the impact on the community? Is that lots of injuries or death, or were there a disruption to life, like destruction of homes or workplaces, things like that? And really, is this overwhelming the normal coping capacity of the individual? So sometimes disasters happen in communities that have lots of resources and are really resilient, and that would not be, there wouldn't be a need to request this service. But there are other times when we know that that can become overwhelmed. So we would definitely also think about, well, what are the considerations related to law enforcement or first responders? How is that impacting the ability to recover from these events? And of course, we also want to know that we have the volunteers who are appropriately trained to be helpful. So those are the questions that we might ask ourselves. After we receive a request for services, our leadership team is going to make a decision very quickly. Within 24 hours, we try to get back and say, yes, we can respond to this. And then we would work with whoever is making the referral to develop a plan, essentially. How are we going to respond? And then we would be helping them to create some marketing so that they can get the word out to their community that was impacted about this service. And of course, we're also organizing our volunteers to be ready to respond. When we do a response, we have a few ways that we can respond. We can do that virtually, or we can do it in person, depending on what the need is. In addition, we can respond individually So if, someone is needing one-on-one services, or we also have protocols that are excellent for groups. So we could, have a group protocol where everyone's receiving the same service and care to bring down the distress related to this event. We typically would do, if it's virtual services, we offer up to 5 virtual services, or we may have one in-person session or group session. And then there is an option that we could refer an individual on to up to 5 pro bono sessions afterwards if we identify there's really a need for more stabilization. And all these services are free. So that's an important thing for communities, particularly for communities who might not be able to access therapy services. And we're excited that we're able to offer both in-person or groups, or we're able to do the telehealth, because we know that gets in corners of Virginia that might not otherwise be able to access services. So what you could expect would be that our licensed clinicians are going to use very specific protocols designed to bring down the distress related to traumatic events. And so those might be early intervention or EMDR, early intervention protocols. The goal is to turn down the intensity of the distress when people think of that event. We want to reduce the stress and really offer some relief from the bodily disturbances. When you think of that event, what comes up in your body? We want to be able to reduce the distress related to that, so that people can continue to function, heal, and recover from that. We are very clear that we are not, healing all the trauma you've experienced in your life. Our goal specifically is to help individuals return to their pre-event mental health. And we know that some people were already struggling before these traumatic events can happen. Our goal is to really help them get back to the pre-event mental health by really targeting what are the triggers that are around those memories of the event that are causing problems, so that we can prevent PTSD moving forward. This is an image of one of our deployments. We were at a hotel in Virginia Beach, and we had a therapist welcoming people in. I think in that situation we were doing individual sessions in the hotel conference rooms. So I'll tell you a little bit about what we've done previously, our previous deployments. So after August 12th in Charlottesville, the white supremacy terrorist attacks, we had a response. That was our very first response. We actually had VCRN clinicians on the ground that day during those events, welcoming people into a local church, helping them to settle using some of their protocols to support their needs in that moment. And you can kind of take a look. We've responded after I believe it was also a white supremacist rally in Richmond, a drowning. In 2018, we went back to Charlottesville to support on the anniversary of August 12th. 2019, I know many of you probably participated in responses in Virginia Beach after the shooting. We responded in 2 ways to that event. We had some clinicians go and support right after the event with the police and SWAT and other first responders immediately after the event. And then we went back about a month later and offered 2 separate clinics, one for first responders and one for employees who had been there the day of the shooting. There was a car crash in Yorktown we responded to. In 2020, of course, everyone had to pivot, and we turned to telehealth during that year. And that was great for us because, again, we're able to now access individuals who previously maybe would not have services in their community. And one of the things that we did was we responded to the COVID pandemic, specifically to essential workers, medical professionals, school workers, other individuals that had to go to work in the very beginning of the pandemic when they didn't know what was going to happen or how that was going to impact their health or their family's health, or they were really struggling with the work that they were having to do. We wanted to help reduce some distress. And so over the course of that year, we offered, you can see, over 144 hours of telehealth counseling to Virginians all over the state. For over 52 essential workers were served. We continued that COVID response a little bit into 2021. There was a response in Richmond after the murder of a child. In 2022, we expanded and received some specialized training in protocols to respond to the refugees that were here from Afghanistan. And you can see in 2023, we've had probably the most responses so far around things like suicide in a work that impacted a workplace, the UVA shooting, shooting in Chesapeake at the Walmart. We responded to VIA for after the deaths of 2 students that were unrelated, but really impactful to the staff there. And here in Charlottesville at the Haven to support the community after the death of one of their employees, and then 3 siblings who drowned and the impact of that on their community. So we are really trying to get the word out about what we do, because our goal would be to really move into some of the more underserved communities in Virginia. We want to make folks aware that this service is here, that we can show up, we can provide free therapy that's really going to have an impact in the immediate sense. We're going to reduce the distress you're experiencing when you think about that event, and really support people in having additional coping strategies moving forward. So you can kind of see here how many hours our volunteers have contributed to these deployments. And of course, in 2023, this was back in July, we've had quite a few. This graph was made in July, so we've had quite a few deployments since then. That will definitely be higher. So I want to put this here. This would be a great shot to screenshot or take a picture of if you want to just have our contact information. Of course, everything is all on the website, but we are available for if someone wanted to request our services, they could do that through the email or our phone line, or go through our website. And when we do our deployments, we often have individuals in the community sign up through our website for the service. And that way we're able to gather and collect their consent to be treated and all of that information. But we also collect, we get them to do an impact of the event scale before their services. And we collect that again a month later, so that we're really able to see this work is impactful and it is effective. And of course, we have a presence on social media. And so that is my presentation. I don't know what questions you have, but I would love to open it up to questions.
Sarah, I will go.
Great.
So it sounds like there's no event too big. Are there community events? Because, we have professionals that work in local government agencies and in other nonprofit organizations, and folks in our CSBs that, and a lot of people on this call that sort of pitch in when there is, let's say, the death of a police officer in a small rural community or in a larger one. Let's say a suicide homicide event. So what about in instances like those?
Yeah, I think what we really do is we look at, does this community not have the resources to respond to this event? So, of course, we wouldn't want every single time someone in Virginia dies to get a response to that. But if that community doesn't have the resources, or for example, are overwhelmed by the event, or many, many people are impacted by that, that's when we would respond. And some of the times our responses are not just for the survivors or those directly impacted. Sometimes our responses are for the helpers who are overwhelmed. So, and that actually, we've done that twice after the shooting at UVA. We didn't go in to serve students. We went in and served the staff of the counseling center at UVA, who were overwhelmed with all of the students that they were supporting. And we also did that after the shooting in Walmart in Chesapeake. There had been a therapist's office who were supporting so many of the individuals who had been impacted by that. They were overwhelmed. And so we went in to offer the services to support them. So we really are willing to be creative about what is the need. And we just want to make sure that when our volunteers show up, when they take off from work and they come and show up, they're able to serve the community there. So that's one question we have is, are people going to show up and are they going to use the service? And if they are, then we are happy to serve that community.
I have a question in the chat from Dr. Erin Shames. Now
I
somebody.
see that if they don't have a professional, we really don't need a professional to sort of assess what that is, because what we're saying is, like in the slide in the beginning, are you seeing this type of signs of distress? We can have community members who are just like, we don't know what to do. And yeah, absolutely. We would partner with them to sort of say, well, what's the need here? What could be helpful? Would it be something like a group protocol where we come and we work with, 10 or 15 individuals at once who have experienced this? Or does that not make sense? And we need to, set up individual telehealth appointments with the 5 people who are most impacted.
Melissa Early has a question.
Go for it.
It's actually more of a statement. I sent it to Sarah individually, but I figured I would just put it out there. When we were deployed to New Bern, North Carolina on the EMAC for Hurricane Florence, when it was like 29 nurses, a mixture of VDH and MRC. And after we came back, I know that myself and a few other folks reached out and got some help from the organization, and it was awesome. It was, short term, very, focused, and very impactful. So
Awesome.
thank you, and I can vouch that it's phenomenal.
I really appreciate that. Yeah, actually, you saying that is really impactful. We know, particularly working with like first responders, when someone has experienced the protocols that we do, they then say to their colleagues or other people, try this out, and we get so much more traction in that way. And so I really appreciate you saying that. And you're right, these are short term, and we know we actually can provide some relief in a really short term. Sometimes it can just be 1 or 2 sessions and people are saying, man, I'm feeling better. I'm not holding the same amount of stress that I was before engaging in these protocols. Thank you, Melissa. Any other questions? All right. Well, you are welcome to reach out through the website or our email or phone number, and you will get a board member who will always be able to help you if you have more questions or if you'd like to make a referral to the VCRN.
Thank you, Sarah. Thank you so much for the information, and thank you for all the work that you all have done and continue to do. I'm so glad that so many people on this call, I know that they have a responsibility similar to mine at their community level. So it's so good to let them know that there's an organization out there, so that when the thing happens, it doesn't feel so burdensome. And now is the time when the sun is shining, right? Now is the time to plan. Now is the time, we talk about in our orientations about doing this work now, about making the plans now, making sure that those relations are developed now. So when the time comes, there's not a whole lot of discussion about how we're going to do it. It's been decided, and we can just deploy and determine what resources that you have in your organization, how big the event is there more than one FAC, for example? All these things come into play in your planning. So thank you for that.